Well, this conversation is one that I look forward to, and I hope it's one that you'll also enjoy. We have with us this morning former Minister of Health, Dr. Mohammed Ali Pate, who's now the Global Director, Health, Nutrition and Population with the World Bank Group. Doctor, you're welcome to Sunrise Daily this morning.
Thank you very much for having me.
When COVID-19 struck, this is a very personal question. Were you grateful to God that you were not the Minister of Health of Nigeria at that time? Just wondering.
I have to say, it was my sympathies to all those who were leading efforts all over the world in their respective countries at that moment. Knowing what we went through during previous outbreaks, the COVID-19 challenge was one that I believe every leader everywhere must have had a very challenging task on their hands.
Well, it was their challenge at that point, it would seem, not yours then. But then, I'm sure that at the position that you occupied, I mean, there definitely, or you currently occupy, there would have been thoughts as to how you could help leaders around the world, particularly those in Africa. And I don't know if your thoughts came home to Nigeria as to how you could be of help. Did you reach out in any way?
Yes, I think immediately we saw a health crisis rapidly engulfing the global economy overall, even though it started from the health sector. It's an unprecedented challenge. We saw it unfold from China to Europe, to North America, and to all over the world. So as the bank, we immediately went into action in March, and by early April, we had approved $6 billion package, which supported 110 countries all over the world to respond to the emergency crisis, have test kits, mobilize their frontline health workers, improve their health systems to be able to deal with it, and to mobilize in terms of the surveillance systems and their infrastructure. That provided help to many countries in Africa, and Nigeria was included in that. And by October, when vaccines began to be available, we went back to our boat and got $12 billion additional financing to enable countries acquire the vaccines, but also deliver those vaccines and strengthen their health systems, not only in the context of COVID, but also for other diseases that afflict their population. That is on the health front. But there is a wider social and economic impact of the pandemic, which is also still unfolding, which the bank stepped in and tried to help countries to deal with those consequences as well.
It is true that, a lot of countries are still reeling from the aftershocks of COVID-19. And now there's a third wave in some countries. There's some countries that are still mooting whether or not they'll go on another round of lockdown. But thankfully, in Africa, we have been spared largely the consequences. Largely, I must say. It was not as bad as was envisaged. It's now a long journey from when COVID-19 broke out to now when the vaccines, have finally arrived in Africa. Did you have any doubts as to how it was going to be received, considering the misinformation that had gone on, during the COVID-19 pandemic, the source and all of that, and how, even in how developed countries, vaccine hesitancy, which we are beginning to see, and even the controversy again, given also that we're a highly religious people, did you have fears as to how it was going to be received here, and what are the gaps between what you thought would happen and what is currently happening with vaccination?
At the foundation, to affect people's behaviors, they have to trust the information that they are getting, and the channels through which they get that information must be credible. So in our response, in the initial $6 billion that we put in, there was a component specifically for risk communication and community engagement, because we anticipated whether it's getting people to wear a mask, to do physical distancing, wash their hands, they have to believe in really what they're being told. So that is something that we've embedded in the context of our help to countries to respond to the pandemic. Now, in the context of Nigeria and many African countries, I think previous outbreaks have enabled the public health systems, particularly in this country, to actually have the muscle memory that when COVID hit, it was easier to organize them. To organize things like the Emergency Operations Center or the Presidential Task Force that exists for COVID-19 response on the back of experiences with other infectious diseases like polio. So those came to being. but also the mechanisms of engaging religious leaders, community leaders, traditional leaders in terms of channeling the right information would help. The issue of hesitancy is a global phenomenon, but it's also contextualized in terms of issues in particular geographies and how it's driven. In our own context, I do hope that our leaders will really continue to reinforce the message that the vaccines are safe, they are efficacious, and they will help protect, save lives, and also help reopen economy, our economy, but also hopefully globally, others will also do that.
Indeed, and that's what a lot of people are hoping will eventually happen. But we know that what we have right now in terms of vaccines, a tiny fraction of what is needed to achieve herd immunity. What are your hopes? Thankfully, some private sector entities are already stepping in. We heard in that report that MTN just sent, I think, 300,000 doses as well. The PTF says they're in receipt of that. What are your thoughts in terms of how Nigeria, maybe I should be more general about Africa, will be able to get the herd immunity which it needs to be able to say, yes, we have this virus under control, when you look at the fact that we're still very dependent, heavily dependent on getting vaccines from other parts of the world?
There are important lessons to be learned. I think we knew, even from March last year, we published a paper that basically called for a fair allocation mechanism for vaccines when they are developed, to develop those vaccines faster, to do them at scale, given the challenge ahead of us at that time. So ultimately, when the vaccines have became available, and what we're seeing right now is that there's a two-track world. The high-income countries are able to immunize their population. More than 500 million doses have been distributed. More than 100 million people have been fully immunized. But many of them, the vast majority of them, are in the high-income countries. Only about 30 million doses have been distributed among 52 lower-income countries. So you see a two-track world where some parts of the world might get to 80% of their population coverage, and other parts of the world might struggle by the end of the year to get to 20–30%. The issue is manufacturing of the vaccines. And at the moment, we're in the middle of a pandemic. This is something that I think we should take as a lesson and ensure it doesn't happen again, that we have the capabilities to manufacture these products in a distributed manner within the Africa region, within our countries, maybe starting from simpler parts, fill and finish, and then to establishing things that can produce the platform vaccines, the newer technologies. That's something that we can make up our mind to learn the lesson of this pandemic and ensure it doesn't happen again. And there are also other things that actually fit into the vaccine supplies. The needles and syringes, the glass vials, and other inputs that we can contribute. There's a whole value chain around vaccines that we could tap into. Not only vaccines, other biologicals, other pharmaceuticals. We cannot depend in this world of today that all our important life-saving interventions have to come from outside. I think it behooves national leaders to actually think about strategically their own interest and building the capabilities within their countries and invest to get there together with the private sector, while also reinforcing their core health systems capabilities to deliver those vaccines or commodities when they are available.
So what do you then say to people who are, because you talked about the whole value chain, and it would seem that so far so good, we've not really been able to contribute anything, much, let's say, if anything at all. What do you say to those who say that this should not be the priority for us? Given the fact that COVID-19 did not wreak as much, it wreaked its own havoc, and maybe we should not quantify it, but in terms of priorities of health, that COVID-19 should not really be a priority for us, considering the other diseases that ravage us and considering where our healthcare system is. The monies which we're spending, the humongous amounts of monies we're spending to procure the vaccines, could go into other areas that primarily affect us as a people. What are your thoughts on that?
Well, the pandemic is still unfolding. We have not seen the end of it yet. This is a virus that is continuing to change. We're seeing stories of mutants emerging. So the trajectory of this pandemic is far from being completed. You mentioned the first surge, the second surge, and some countries seeing the third surge, although not in the African continent at the moment. But we are yet to see the end of it all. So beyond COVID-19, what I'm speaking about is there are other vaccine-preventable diseases. We do need vaccines to prevent our children from getting measles, from getting pneumonia, but all of those vaccines, we import them. We need to invest in our health systems at the core, the frontline health systems, the health workers, the testing capability, the diagnostic abilities that need to be embedded in our health systems. If I ask you today, for instance, for many of the viruses that are circulating in Nigeria, do we know the character of the viruses or what kinds of mutants are in those? I'm sure NCDC is doing an excellent work. Dr. Chikwe Ihezuo is one of the best experts in this field. But there is a limit in terms of the capability that we have to even understand the viruses that are circulating in our population. So we need to learn the lesson and not just go through cycles of panic and neglect after the pandemic is over. This is just one infectious disease in a series of infectious diseases that have emerged. And there will be more likely. In the last 25 years alone, there have been several viruses that have emerged, from Nipah in the late 90s, to SARS, the first coronavirus in 2003, to MERS, to Ebola, and then now to COVID-19. So investing in health system is core to our economic security and also to our national security. This virus is there, and it may fritter out over time, or it could get a bit more widely distributed, as we've seen from the emerging variants.
The question is about priority. If you had to pick, where would you say, I mean, because funds are limited, they're scarce, where should we be investing more?
I think it's important to have the right balance in terms of strengthening the primary healthcare system, the frontline health workers, and also having those commodities that are necessary and apply them to stop the transmission of this virus. In addition to vaccines, the physical distancing, the masking, hand washing, the behavioral thing, the core public health interventions also have to continue, because it will take a while before we get to the point where we have immunized all the population that we need to. We can do faster, but I think we need to have a full complement of services that we promote to deal with the COVID pandemic, but also the secondary crisis. We focus on COVID-19, but there is also a secondary crisis that COVID-19 has unleashed. Interruptions in reproductive, maternal, newborn, and child health services, which itself is very important. Immunization against other childhood preventable diseases. The governments have to strike the balance within the constraints of the fiscal resources that is available to them.
Indeed. Well, I think the forthcoming days will let us know whether government is striking that balance or whether or not it's tilting towards one end. But we have to thank you so much for sharing your thoughts with us this morning. We could go on and on with this conversation. Our time is limited. Dr. Mohammed Ali Pate is currently the Global Director, Health, Nutrition and Population with the World Bank Group. Is a former Minister of Health of Nigeria. It was a real pleasure having you here on
Thank you very much.